Greetings, fellow North Carolinians. Thank you all for joining us this afternoon. My name is Quinn West Godwin. I serve as the Central Regional Field Coordinator for the 75th Governor of North Carolina, Governor Roy Cooper, in his Office of Public Engagement. Governor Cooper, along with Cabinet Secretaries, agency staff, and thousands of state employees, have been working nonstop to fight this pandemic and help the people of North Carolina get through this tumultuous time. This is OPE's 10th weekly webcast. Our purpose is to have multidimensional information sharing to make sure we are available, transparent, equitable, and connecting with all North Carolina communities during this crisis. Today's program will focus on information and updates about Phase 2 of Governor Cooper's reopening plan, which North Carolina moved into last Friday, May 22nd. To give you an overview, Phase 2 lifts the stay-at-home order, moving into a safer-at-home recommendation, especially for people at high risk for serious illness. Teleworking is urged when possible. Mass gathering limits in Phase 2 will be no more than 10 people indoors or 25 people outdoors in most circumstances. These limits apply to the following: event venues, conference centers, stadiums and sports arenas, amphitheaters, and groups at parks or beaches. Some businesses will remain closed in Phase 2, including bars, nightclubs, gyms, and indoor fitness facilities, indoor entertainment venues such as movie theaters and bowling alleys. Certain businesses are open at limited capacity with other requirements and recommendations, including restaurants at 50% dining capacity with distancing and cleaning requirements. Personal care businesses, including salons and barbers, at 50% capacity with distancing and cleaning requirements. And pools at 50% capacity with distancing and cleaning requirements. Employees of personal care businesses are required to wear face coverings. Child care facilities, day camps, and overnight camps are open with enhanced cleaning and screening requirements. Retail businesses allowed to open in Phase 1 at 50% capacity will continue at that level. Public health recommendations are provided for worship services to practice enhanced social distancing and other cleaning and hygiene practices. The Safer at Home Phase 2 runs through at least Friday, June 26. And just like our previous sessions, we encourage you to engage with us via the YouTube stream chat or the WebEx stream where you can send questions in real time. During our program today, we will hear from Mr. Benjamin Money, Deputy Secretary for Health Services at the North Carolina Department of Health and Human Services, Ms. Caroline Farmer, Director of the Office on Volunteerism and Community Service, Mr. Barry Porter, Regional Chief Executive Officer for the American Red Cross, and lastly, Mr. Jeremy Collins, Director of the Office of Public Engagement, will provide Division of Employment Security updates and address added concerns submitted today and close our session. Again, thank you all for being with us this afternoon. We also encourage you to visit the North Carolina Department of Health and Human Services website at ncdhhs.gov/coronavirus, where you can find other resources and information. With that being said, I invite Deputy Secretary Benjamin Money to the stage. Thank you.
Thank you, Quinn, and good morning, everyone. We're now in Phase 2, and we call that Safer at Home. So what got us here were North Carolinians taking individual actions to stay at home so that we could flatten the pandemic's curve. We did this together, and it worked. We slowed the spread of the virus, and we put ourselves in a good position to begin easing restrictions. So it's important to remember that our individual actions will continue to determine our path forward. So let's talk a little bit about face covering, shall we? So I have my face covering right here, and I wore it as I was coming in today. And you know, while the executive order does not require North Carolinians to wear face coverings outside the home, it is strongly recommended. Remember, people can have COVID-19 and not have any symptoms. Face coverings help protect your loved ones and your neighbors. it really is a sign that shows that you care. You care about the other person. As Quinn mentioned, the executive order does, however, require employees of personal care, grooming, and tattoo businesses to wear face coverings. And we also strongly recommend that customers wear face coverings as well while they're in those businesses. As a reminder, while this order lists the governor's stay-at-home order, we have moved to a safer-at-home recommendation. High-risk individuals are still encouraged to stay home, and just over half of the adults in North Carolina are at higher risk for severe illness from COVID-19 because they're over 65 years of age or have at least one of the underlying health conditions, or actually both. And since we don't have a cure or a vaccine for COVID-19, we all have to learn to live as safely as possible with this virus until we do have that vaccine. We know from decades of public health research that there are 3 simple things that each of us can do to help protect ourselves. And that is the 3 W's, and I've talked about this before: wearing a face covering, waiting 6 feet apart, and washing your hands frequently. Our health and our economy really depend on all of our individual actions. We all have a very important role to play. So when you go out to eat, bring your face covering with you. When you're shopping, make sure you stay at least 6 feet apart from others in the line, because collectively these actions can both energize our economy and protect our public health. As I went out for walks over the weekend through my neighborhood and once to the grocery store, I noticed an inconsistent use of face coverings and maintaining social distancing, even when in the grocery store, spaces were marked out with little circles as to where to stand. So I'm very concerned that people don't lose sight right now of just how virulent COVID-19 is. Remember, we're in phase 2, but that is safer at home. So if you want to follow how the virus is spreading across the state, our organization, North Carolina Department of Health and Human Services, just launched an interactive COVID-19 dashboard. This dashboard provides an overview on metrics and capacities that the state is following to inform the decisions we're making so that we can responsibly ease restrictions as we slow the spread of the virus. It also includes the ability to filter cases and deaths by demographic information. So looking at race, ethnicity, gender, and age. So for example, if a user selects one of those categories, they can display a particular breakdown for that group. It's important to note, as we've passed through the Memorial Day weekend, that on Saturday, we reported the highest one-day number of laboratory-confirmed COVID-19 cases, with 1,107 cases reported just on Saturday. And so, as of yesterday, there were 24,628 laboratory-confirmed cases. Again, those are laboratory-confirmed cases. We know that there were 364,156 completed COVID-19 tests. Currently, there are 702 individuals that are hospitalized as a result of COVID-19, and unfortunately, there were 794 cumulative deaths thus far from the disease. So it's important to recognize that as we've been able to acquire additional personal protective equipment and materials for laboratory testing, we actually are encouraging and promoting asymptomatic testing. And we are actively listing the sites that are available across North Carolina for testing. So you can actually go to our website and find a testing site, the location, the date. You can even find it on a map so that you can participate in testing. But remember, it's important, if you're in a high-risk group, stay at home. If you have symptoms, make sure that you do get that test. But stay in touch with your healthcare provider. Follow the practices that I mentioned before, the 3 W's. And remember, it is safer at home. I do want to say, though, that last Friday, as a part of phase 2, restaurants began opening up for in-person dining at 50% capacity and are using, as Quinn mentioned, enhanced cleaning and health screenings. Restaurants are a major part of our economy, and this virus has been really tough on that industry. So as we enter phase 2, restaurant owners across North Carolina are focused on how to keep their customers and their employees safe. And to help with this effort, the North Carolina Department of Health and Human Services has been working closely with the North Carolina Restaurant and Lodging Association, North Carolina State University's Extension Agency, and Visit NC to develop an online curriculum for the owners, managers, and employees of restaurants, hotels, and other businesses. It's called Count on Me NC. So Count on Me NC is a free online training. It's focused on advanced cleaning, disinfection, social distancing, and hygiene practices to better protect the public and employees from COVID-19. When restaurants complete the course, and restaurants and businesses have the opportunity to sign up, and when they do complete that course, they get a sticker for their window and a logo that they can put on their website to show their commitment to using new safety protocols. You also may see your server wearing a Count on Me NC pin or name tag. Really encourage you to compliment and support your restaurants that are participating in this program. Demonstrates that they care about your health as well as the health of their employees. Thus far, over 3,500 individuals representing over 1,800 businesses have completed the training, with more signing up every day. You can learn about Count on Me NC by going to countonmenc.org to find a list of businesses in your area that have already completed the training. This innovative effort is possible because of the strong and long-standing partnerships we have with industry and our universities. As far as we know, it's among the first of its kind in the country. So as you go out to restaurants, look for that Count on Me NC signage. Thank the restaurants for their participation and their concern. It's also important to recognize that this is a time when the spirit of North Carolina, just like Count on Me NC, can really shine. And it's shown through volunteer efforts on the part of citizens, residents across the state of North Carolina. And coordinating many of these volunteer efforts has been Carolyn Farmer, who's with the Governor's Office on Community Engagement. And at this time, I'd like for Carolyn to come up and give us an overview of some opportunities and efforts that are taking place across the state to support our community as we go through, mitigate, and come out of this COVID-19 virus. Thank you so much.
Thank you, Ben. My name is Caroline Farmer. I'm the director of the Commission on Volunteerism and Community Service for the state of North Carolina, located in the Governor's Office. As Ben said, volunteerism is extremely important, and it is something that we will continue to need help. But as we're moving into phase 2, there are some changes that we're seeing. First of all, just in your day-to-day life, more people are out, more people are wearing face masks. As Ben said, be grateful. Thank the people when you go to establishments who are wearing masks. Because if you're both wearing masks, that helps protect a lot of people. So along those lines, I want you to think about your actions. Be aware of those people around you. I was with teenagers, my kids, this weekend, and they were jabbering on and not thinking about, as they walked down the sidewalk, another person coming towards them. So you have to be aware of your environment. You have to be aware of, the plexiglass at the cash register. There's a reason it's there. We have a tendency to want to move around it, but you need to actually be aware and respect the precautions that people have put into place. As far as volunteer groups, nonprofits, and the like, they are encouraging you to volunteer. They need you to volunteer, but they also need you to do so when you're healthy. They need you to do so wearing a mask, to make sure that you are clean when you walk in the door and that you wash your hands frequently while you're volunteering. And also, if they ask you to do cleaning of your area every 30 minutes, do it. It's for your protection and others, because we don't want the virus to continue to spread. So Be aware of the number of people. As Quinn mentioned early on, is the fact that 10 people indoors, 25 outdoors in terms of gatherings. Now, for nonprofits that are especially doing necessary work, such as food banks, they may have a larger environment. They may have a warehouse. They are going to need more people. So be aware of your surroundings, and I encourage you to volunteer. We have a website. It's called volunteerinc.org, and we have postings about volunteer opportunities that are COVID related on that site. You know, as we're coming into phase 2, as we're thinking about what kind of place we want to live in, what kind of community we want to live in, we want to live in a place where neighbors help neighbors. And as such, I want us to think about what skills we have, what time we really have, and what a difference we can make in our community. Look for volunteer opportunities. I will say almost every day we are sending out an email to those people who have signed up on our volunteer list about a school that needs help, delivering meals to children because the buses are not running in that area, or Meals on Wheels for seniors. I want you to be aware of what's happening around you. Are the most vulnerable of your population getting help? Are they getting food boxes delivered? Are they getting the medicine they need? Are they being forced to go out because of the fact that they don't have anyone to deliver the groceries and so forth? Look for opportunities to volunteer. This is not a time where we sit back and be excited about the fact that we can go to a restaurant again. Yes, it's lovely, and I want you to enjoy that, but I also want you to think about those people who can't help themselves and make sure that they are getting the help that they need during this crisis and that they are getting the support that they need. This also includes mental health. I was talking to a state employee last week who has taken it upon herself to call people who are isolated, that the church goes by once a week, but that's the only communication that they have. So she reaches out on a daily basis just to check in and make sure that they're doing okay. She really doesn't have a close relationship with these people beforehand, but now she does, because she's taken it upon herself to make sure that they are doing well mentally. So phase 2 should mean that we are able to volunteer more. There's less risk at volunteering, but I want you to make sure you do so safely. 6 feet apart with a mask and cleaning often. So I encourage you to keep volunteering, keep your spirits up, and help those who can't help themselves. Thank you.
Good afternoon, everyone. My name is Barry Porter. I'm the Regional CEO for Eastern North Carolina. It's an opportunity that I appreciate that the Governor's Office has been working with us during phase 1, during the stay-at-home order, saying that giving blood was an essential act and that we would invite you to come and to donate blood in a safe environment. Now, as we move into phase 2 and the safer at home, please note that blood donation is still very important. I should tell you that during the initial phase of Stay Safer at Home, what we saw happening was the fact that blood donation ramped up, and now what we see is that blood donation is actually declining. Particularly, it's declining in one segment of the community, and that segment of the community is the African American community. And it's an important thing to know. All of us have blood types, A, B, and O. Those are very, very common. But what we also find is that as a patient gets multiple blood transfusions, what happens is they develop reactions because of the new tissue that's introduced to their body. The closer we can match that with race or ethnicity, the better. And so what we have seen, however, is in our area about a 50% drop in blood donations among the African American community. We know there's a couple of reasons for that. One is simply access. getting to blood drives that have been canceled. A lot of African American churches and historically black colleges and universities have hosted blood drives. Those aren't happening. Transportation support to get to a blood drive is also critical, but the need is important. I can tell you as an example, at Duke University and here in our area of North Carolina, we are supporting sickle cell relief efforts. Patients who go routinely to get sickle cell treatments require multiple blood transfusions. A young woman I spoke to recently, Ms. Williams, who talked about how having sickle cell is feeling like when she has an episode because of stress and other things that come on in her body is like shards of glass running through her body. And so she goes to the hospital to get blood transfusions. But what she needs is a close a match as possible from a donor that matches her racial identity. While typically she could get a blood transfusion, because of the multiple transfusions she gets, it's important that she gets a transfusion from an African American donor. And with donations dropping overall and in a 50% drop amongst the African American community, it's very important that we encourage everyone to give, but in particular African American and Hispanic, who have higher incidence of the sickle cell illness. So if you are in the community across North Carolina and would like to do something to support, call your local blood collector. I'm here representing the American Red Cross, the nation's largest provider of blood across the country. At the same time, there are other blood collectors. So this administration has been very, very supportive during the stay-at-home orders and now wants to help encourage folks to continue to sponsor blood drives. They're pre-approved, they're safe, the environment is healthy for us to provide a donation. So when we do come to a location, donors are safe, we wear masks, the donors are wearing masks. It's a very safe environment. So it's an important aspect. We appreciate the administration's support. We appreciate the fact that we've had the First Lady in the office of the First Lady donating blood and making a difference as we help save lives across the state. Additionally, we also are encouraging folks who have been exposed to the virus to go to the Red Cross website and register for convalescent plasma. A treatment that makes a significant impact is antibodies in a person's plasma. So if you've been exposed and diagnosed by a physician and have a valid documented case of COVID and are fully recovered, please go to the redcrossblood.org. Register on that website to consider donating plasma, which has antibodies, that is being one of the most effective treatments against folks or helping folks recover from COVID-19 disease. As an organization across America, the Red Cross has provided over 5,400 transfusions of this product, but we need more for months to come. So if you're healthy, if you're at least 16 years of age, and particularly if you are type O negative, O positive, or African American heritage, please consider a blood donation to help your community and those in need. Thank you very much. I now will introduce, I think, Mr. Jeremy Collins.
Good morning. First, I want to thank everyone for being with us, both virtually and here to make presentation. Thank Quinn for his leadership, and Ben Money from the North Carolina Department of Health and Human Service, Caroline Farmer from our Volunteerism Office and Community Service, our new friend, Mr. Barry Porter from the Red Cross, the American Red Cross, and the entire team that goes into putting these on. My name is Jeremy Collins. I direct Governor Cooper's Office of Public Engagement. And on behalf of the governor, again, want to thank you for your diligence in doing this. I think also before I go forward, I want to make sure that I thank our team. I mentioned Quinn earlier, Okira Harris and Maddie Lazo-Chatterton, and the entire engagement team that continues to communicate with folks all across the state. We have another call later today for our Hispanic and Latinx community members to provide timely updates. The purpose of this has been stated is to kind of go through some phase 2 developments and phase 2 updates. And I'm going to start with giving you an update from our Division of Employment Security. You may have seen via press release yesterday that the governor has appointed a new leader of that division. His name is Mr. Pryor Gibson, so Director Pryor Gibson.
You might remember his voice and his beautiful face from our Hometown Strong division, and so we want to congratulate Pryor for moving into that space. Pryor brings a level of tenacity, and if he was standing here, a level of stick it to it that I think will be very helpful for the division. And so if you've got issues, I encourage you again to reach out to the Division of Employment Security. I'll give you a few updates from that division's office. One, over 950,000 individuals filed for a total of 1.3 million claims for unemployment insurance to date. In addition, the Department of the Division has paid out over $2.7 billion to date. As of Friday, May 22nd, the Pandemic Emergency Unemployment Compensation Program has paid out, from North Carolina, has paid out more than $11 million in compensation to North Carolinians across the state. One of the misconceptions that we're hearing as it relates to pandemic unemployment assistance is that people are thinking they're eligible for PUA or pandemic unemployment assistance because they have exhausted their regular state unemployment insurance benefits. Please note that pandemic unemployment assistance is only for individuals who are not eligible for any regular state unemployment benefits or any extension to include the pandemic emergency unemployment compensation. Also, you got to be out of work to be eligible for pandemic unemployment assistance. You got to be out of work as a result of coronavirus. Finally, I want to remind folks, you must continue to do the weekly certifications. The only time you stop doing the weekly certifications is when you are ready to not receive the unemployment insurance benefit or the pandemic unemployment assistance or the pandemic emergency unemployment compensation. I know that's a large amount of information for a short amount of, in a short span. I'd ask you to visit the Department of Employment Security's website under our North Carolina Department of Commerce. What we want to make sure you got this information because many of us are in different phases of recovery. So in state government, we're at this safer at home space, and we're talking about phase 2 and what folks are eligible to do. But many of us are experiencing different phases of the pandemic. Some of our community members are out of work and haven't seen work for over 2 months. There are many folks who are in some form of lesser work, where maybe you're a contract, a 1099 or a contract or vendor type employer or employee, and so work is slow. And so it's important for us that we don't speak from just what phase of response or recovery in, but speak to every phase that North Carolinians might be facing. And so with that, I'm going to give a few additional bright line points. One, we've had some questions about churches and what churches are eligible to do. We put out a fair amount of guidance. You can always visit our North Carolina Department of Health and Human Service website. That's ncdhhs.gov, and there's a particular page just for guidance. So again, if you would like to learn more about what churches are eligible to do, what businesses are eligible to do, ncdhhs.gov. Churches are not subject to the mass gathering ban. Again, churches are not subject to the mass gathering ban in phase 2. What that means is, if you are a house of worship, you are able to gather, considering that you follow the 3 W's to wash your hands, wait 6 feet, and wear a face covering. You are eligible and able to gather. Now, as just a point of common sense, we advise that you be really wise about the way you do that. The virus doesn't jump over church steeples and restaurants, and what we don't want to see is that we became relaxed in a particular setting, and then we see an uptick in positive case counts and deaths of COVID. Not trying to scare anyone, but want to make sure that you're well aware of what you're able to do. If there's a question as to what your church or faith community can do, please feel free to reach out to our office. You can send us an email at ope@nc.gov. We'd be more than happy to help to walk you through any of the regulations, but I want to make sure that you're aware that churches in phase 2 are not subject to a mass gathering ban allowing churches to gather. However, many of our churches have an enterprise that is connected to it, be it a nonprofit organization or some sort of connected business. Please understand that that business is not the same as a worship gathering. And so your church may gather and have worship observance, but if your church, let's say, also has a gym attached to it, just because the church is open does not mean the gym can also function. And so be mindful of that as we're moving through this phase. Phase 2 is going to be a lengthy one. It's scheduled to be in place for 5 weeks, and we're just 1 week in. And so I'm sure guidance will change, but again, phase 2 is scheduled to be 5 weeks. And so we're going to be here to kind of keep you updated with as much as we can. Next, we got a question last week about youth sports and what that would mean, and can communities carry out their youth sporting events. The mass gathering ban does apply to youth sports. And so you cannot, let's say you've got a t-ball league or a softball league, understand that we are still not condoning that level of sport activity. Although pools are open, we're not in a place yet where folks are playing some level of contact sport, and we are limiting the gatherings of folks that can be in crowd. The mass gathering ban does apply to sports venues and amphitheaters and things of that nature. So, again, we have that guidance posted on our Department of Health and Human Service website. And remember that the guidance is not for us to control your activities. The guidance is for us to keep you safe and healthy. We would love it if everyone was out and doing all the things that they love to do, but we're not able to experience that luxury right now. And so we're giving you the best guidance we can with the information that we have. I think you hear Governor Cooper and Secretary Mandy Cohen say on a weekly basis, we're going to let the science lead us. We're going to let the science lead us. And I've seen several questions in our stream today about, does the science support reopening at any level? And does the science support us having bars open? And you've seen the governor's guidance. We did not reopen bars. We did reopen restaurants. What we're doing is looking at the science and also listening to the folks who are in our different communities. And I will admit there's an attempt to strike a balance. We want to be led by the science. We also want to be sensitive to what communities are saying. And so a lot of communities are hurting economically. A lot of communities are hurting from a lack of kind of social interaction. And so we do try to ease restrictions at a place to give folks the availability of more services, the availability to continue their individual ventures. Quinn and I were on a call with a gym owner from Monroe last week, and we understand that people will see that a restaurant's open and they feel like their business ought to be open as well. It doesn't matter what the business is. If a restaurant can begin to make money, then my business ought to be able to make money. That's not true. I don't know how to say it. Some businesses function differently than other businesses, and some businesses create greater opportunities for the spread of the virus. And while it's a tough decision, the governor, Secretary Cohen, the coronavirus task force, and many of the folks that you hear from on a weekly basis are put in a tough position to make those tough decisions, but they make those decisions for the betterment of all North Carolinians. And so, again, we post our guidance on our DHHS website. But if you have concerns, if you are a person who doesn't necessarily agree with the guidance and you want to share those thoughts with us, please, as the website address is across the bottom of the screen, reach out to us at governor.nc.gov. That web address again is governor.nc.gov. I think I'll say finally, phase 2 is scheduled to be 5 weeks. The guidance that's currently in place is scheduled to be in place for 5 weeks. That could change. We are seeing a number of legal challenges to the guidance that we've put in place. Just as recently as yesterday, the North Carolina Senate took a vote to reopen bars in opposition to the governor's safer at home order. And so things could change. We ask that you be nimble with us. Our goal is to provide you the most up-to-date information as possible. I'll also let you know that we are now going to schedule these programs bi-weekly. So we were coming to you on a weekly basis, and we're going to change that schedule now to align with the change of our phases. So we're going to do this every other Thursday at 11 a.m. Every other Thursday at 11 a.m. We're going to come to you, let you know how we're doing, give you some updates on the numbers, but also provide you with kind of changes that may have occurred in the guidance. I wouldn't be surprised if by next Thursday, 2 weeks from now, there may be some wrinkles that we need to work out in the guidance and make sure that you have. Finally, and I appreciate Mr. Porter being here today, this is a greater opportunity for us all to work together. I appreciate what the governor is doing. I appreciate what the cabinet secretaries are doing to address all the different issues. We are currently working on a number of helpful provisions to help North Carolinians across the state. We're listening to you about utilities, and we're listening to you about housing. We're listening to you about overpopulated congregate living spaces. And so our hope on a daily basis is to address these issues in a way that best serve all North Carolinians. And if there's an issue that we haven't addressed, again, shoot us that information. The web address, again, is governor.nc.gov. We get that information. We report that directly to the governor. We are in direct contact with him, and then we try to stay in direct contact with you. If there are ways we can be helpful and supportive and increase capacity within different communities, with our food banks, with our Red Cross, with our service, the division, our departments of service provision, if there's anything we can do to help or aid with our community action agencies, let us know. We want to do it. We're here to help, and we're going to get through this together, but we got to stick together while we're doing it. So thank you so much for your time today. If you have questions or additional thoughts, please shoot them to us, and we look forward to keeping you updated as we move through phase 2 over the coming weeks. Thank you.